Welcome, sir. Thank you for your time,
Thank you.
and welcome to the HealthPlix, short interview that we have.
Yeah.
We have, just a couple of quick questions for you that we need your help with.
Sure.
Can you help me with your name and specialty, doctor,
My name is
please?
Dr. Deepak Kubde and I am specializing in interventional cardiology.
Right, sir. So, what is a unique story of becoming a doctor, right? We actually want to know the story of our, heroes and their life stories.
So basically, it's like was one of the dream opportunity for me. And from beginning, when I was growing, I was really admiring the people around me, especially the doctors in the relations. I always wanted to be a doctor, and once I entered this field, I was really fascinated about this cardiology branch. So and here I am.
Great, sir.
Yeah.
What do you think of HealthPlix EMR and which features do you use the most?
The HealthPlix EMR is one of the easy system for OPD patient management, and basically the main important feature I feel is the all the what drugs you prescribing. They appear with the company name as well as the content in it very clearly, so that if by at all patient wants to take any other brand, they can go. The combination is written there. The dosing and all the taking prescription, whatever the instructions are there, we can provide it in native language. No need to type nothing. All the follow-up instructions, all the lab tests, all these simple things are translated into the native language, so the patient can easily read the prescription pad, and that is very useful.
So I guess you're trying to say that the
Language
multilingual,
feature, yeah.
feature that we have on our EMR,
Yeah.
that is quite useful.
Yeah.
Just extending that conversation to the next level, does that also impact the patient understanding towards the diagnosis that you have basically, said to the patient? Because if I am a patient, right, when I go to a doctor, I mean, like if I go to a doctor who is writing pen and paper,
Yeah.
I mean, 99% of the chances are there that I don't understand what is written and I don't understand what the actual cause is.
Correct.
I mean, like, I might have to ask the chemist that कैसे लेनी है medicine,
Yeah.
or I might have to call the doctor himself or herself कि doctor please बताइए कैसे लिए.
Yeah. In that scenario, I would like to say, the if we write the same prescription what HealthPlix gives you print, it might consume one complete paper, or maybe the backside also. But because it is very much organized and printed in a neat format, so usually it takes a very little space, very much readable, very presentable. Patients can easily understand through the prescription. The instructions are very simple and very highlighted. So that way, probably, like you are saying, it is useful for the patients.
A relatable question again on the same point. Does that, have you figured out that, does that also impact the patients getting retained to you?
Yeah.
Because when the patient starts understanding what the doctor is prescribing, right,
Yeah.
does that impact your, you to be basically in that position wherein you are able to retain the patients to yourself?
So that probably may be one of the reason, maybe one of them, not the sole reason, but it makes a whole practice a very concise, very organized practice. So the doctor speaks with clarity, writes with clarity, and patients go with clarity.
They love clarity.
Yeah.
Got it. So, can you share one of the critical cases that you would have managed with the help of EMR, HealthPlix EMR actually?
Yeah, because in cardiology, many patients have 8, 9, 10 medication. Few of my patients are on 10 to 15 medications, some oral, some liquid form. So it is very difficult in written form to write each and every drug with content and with instruction how to take. But organized form which the HealthPlix provide, that is great for such a multi tablet or multi drug user patient.
Is there any one such case that you can recall, wherein HealthPlix played a very, pivotal role in managing that patient and giving that cure to the patient in a timely manner?
So few of the cases are there, they got deteriorated. So initially they were on multiple medications. So with time we can cut off different medications and put on as less as possible. So probably that way, because of this multiple medications have different instructions, so they can like easily see how to take, and so that's way probably the illness or the disease, the cure time or the issue was resolved very quickly, and the patient came to on the less medication very quickly.
I'm not sure if I'm understanding that correct, but since we had the data of all the medicines that we gave to the patients,
Yeah.
we could see, diagnose, and analyze that okay, if I gave this medicine to the basically patient,
Yeah.
this was the result. Now, if this is not working, maybe I'll have to change the medication to the patient that will impact his health outcomes. Is that the correct understanding?
Probably that is one of the things. Whenever the written prescription you are writing, most of the times patient might not bring it to you next
Correct.
on visit. But once you have entered your patient into the system, whenever he comes, just by typing his name, you can just find his old records. That way, probably the doctor might forget what he has prescribed, what the diagnosis was previously. Many times this happens with me because there are too many patients we are treating daily basis. So that way, just we can search the name, we can go through his old records. Suppose the symptoms are new, we can change the medication or whatever the required changes are there. We can do that.
How did you come across HealthPlix EMR, sir?
Yeah. So basically, I came across it through one of my friends. He was already using that last year, so he suggested me. That is one of the simple this EMR system if you want to go ahead. So just it was very easy thing. I just called one of the number he has provided me. The team reached out to me. They have given immediately login ID and password once I have submitted the documents. So a very straightforward thing.
Got it, sir. So, beyond your regular practice, what are the charitable works that you do to serve the community and the society, right?
Yeah. Presently, not in the monetary form, but most of the patients, suppose they are not affording. Most of the time, I waive off their fees and like that. The test I make free of cost. That way, probably that a little contribution from my side. Yeah.
Good to hear that, sir, because a lot of doctors have said many things,
Yeah.
and we are more than happy to basically hear this from all the doctors that whatever that we are doing, it is always good to give back to the society as well. So, what are the biggest, what is the biggest problem in Indian healthcare system according to you, and how do you aim to solve the problem, and how HealthPlix can basically help you to do the same?
So probably the most important issue presently is there is no organized data entry for any patient. So from birth to the death, patient visits hospital many of the time. There is no unique entry point. Like many of the foreign countries, they have their medical system. They will have a medical record number and everything. So the patient will have unique ID. That way, his all records are available to everyone. Here, that issue is there. So probably if you have a concentrated data source where patient's entries are there from beginning to last, maybe it will help to identify many diseases earlier, help to treat the patient also. That way, this probably may be the future of the health industry. Yeah. Just like Aadhaar, probably maybe in future we might get some health related some number or something.
I guess the government is already working on it
Yeah.
to have that unique
Yeah.
ID for each individual. It's more like the Western countries wherein you have NHS in
Yeah,
England. You have an NI number,
Yeah. Yeah.
something sort of that is going to be,
Same.
be in India as well. Uh, Last question, sir. Would you recommend HealthPlix to your peers?
Definitely, I will recommend it. So it is one of the useful system. So they can manage their all the type of OPD work and everything through this unified platform. So definitely, I recommend.
Thank you so much for your time, sir.